My top tips and tricks for aided cortical testing, say first of all, think about the equipment. Particularly if this is a setup where you have to pack it away, bring it back out again, you really need to make sure that you put it back in the right place. So when you have your original calibration, it's ideal to put some markers on the floor to denote where the speaker should be, where the patient should be, the right distance, so that when you bring that equipment back out, you can put it in the right place so that it retains the calibration values. And the other thing that's really important to make use of is the sound field analysis feature in the aided cortical test. This is really, really quick and easy to do. It's basically your kind of stage A check before you start your clinic. And it takes about 5 seconds. You can do this before each patient. You can do it at the start of the day. You can do it once the patient's even in the room, if they do come in with, large amounts of equipment such as buggies and prams and things like that. But what it does is ensure that the presentation levels of the stimuli from the loudspeaker are stable and match the original calibrated value. So really important to do if you are moving that equipment around. And as I say, it's so quick and easy, 5 seconds. There's no reason really not to do it. So that's a really good thing to make use of to make sure that you're getting accurate presentation levels and therefore accurate results. I would say it's really important to have 2 testers for doing the aided cortical test. For an older patient or an adult, 1 tester is usually fine, but for this particular population that we're thinking about in terms of the infants and younger children, then it's really hard to focus on the child and control the software and the equipment at the same time. Inevitably, you're going to end up missing something on one of those, which we don't want to do. So I would really encourage you to have 1 tester who's focused on the child, doing the engagement, reading the child, and then another tester who is focusing on the eclipse, the decision-making, the stimuli levels, and they can read the patient's EEG and then feed that back to the tester who is engaging with the child. And that can then be used to alter the engagement. So if they're too excited, we might need to bring it down. If, the response starts to diminish, it might be that the patient's getting a bit too sleepy and we need to liven up the engagement activity. So really useful to have 2 testers for this age group. I think it's always really useful to have 2 testers anyway in terms of reading the results, cross-checking, oh, have I got this right? Should we do this next? What's my next step? So that sort of sanity check of having somebody alongside you to back up what you're thinking. So I really like having 2 testers for the aided cortical test, as I say, particularly this age group. And then when it comes to engaging with the child, I've got loads of suggestions here. So you want to have lots and lots and lots of toys. For this particular, 3 to 7 month age group, they've got very limited attention span. So you might be changing toy every few seconds. You might need lots and lots of toys so that you've got lots of options that you can cycle through. Sensory toys are the best for this age group. You can turn the lights down and then you have these lovely flashing toys, light up toys, toys that feel really nice. They're very engaging for this particular age group where they can get their hands stuck into them, and that can really keep them in the right state of kind of still and quiet and in awe of the thing that they're playing with, and not too noisy, not too active that disturbs the test. So sensory toys are definitely your best friend for the aided cortical test. As are videos. I think videos are really, really important. And there's so many ways that you can show these. It might be the parent's phone. You might have something like a tablet or a computer screen that you could show some cartoons on there, some videos on there. You could have a really, really big TV screen where you have big cartoons there, and that gets quite a sort of wow factor effect. It's, full visual field for these children. But by far one of the best setups I've ever seen is having a projector and either a massive white wall or a big projector screen. Again, turning the lights down, shutting the window blinds, and having those cartoons shown from the computer via the projector onto this big screen. It just creates this wonderful cinematic effect that captivates the children, and it will keep them sitting there for such a long period of time to allow you to do the testing that you want to. So that's such a great setup to have. Keeps them quite calm, keeps them quite engaged, but really, keeps them happy and content, which is super important for the test. And think about whether they have any favorites. You know, is there a favorite toy? Is there a favorite cartoon? Do they like looking at videos of themselves? I don't know. There's all sorts of things that you can ask the parents about. It's surprising how much favoritism these children can develop at quite a young age. We want the kid to be happy with the test, not bored, not too excited. So pick the content in terms of the toys and the videos that you're going to show them that they are going to find engaging and interesting. And that is how you will get a successful aided cortical test.